Hey Dania, what's up?
Hi Giri, how are you?
I'm good, thank you. Hey, as an on-field trainer for soccer, what are the 3 most common injuries you see in your soccer group?
For me personally, I see a lot of knee ligament injuries, a lot of ankle sprains, and a lot of quad and hamstring strains.
Okay, I totally agree with you. As a physiotherapist treating soccer players for the last 25 years, I do agree with you.
Yeah.
And I think the number one predisposing factor for the young kids especially, and also some adults in soccer injuries is lack of hip and ankle stability.
Absolutely.
Which plays a big role because soccer is a unilateral game. You got to kick with one leg while you're stabilizing on the other leg, right?
Absolutely.
And you're running, it's again, you need unilateral stability. And you're jumping, you need both. So that's what you need. So how about you show our patients what are the things they can do to improve their hip and knee stability or ankle stability at home by themselves?
For sure, I got 4 exercises for you.
Okay, we got 4 coming up right now.
So the first one is going to be the Y balance. So this is going to test your ankle stability as well as your balance. So if you want to place one foot onto the step with your toes on the line. Perfect. So the first one, you're just going to reach forward with the block as far as you can. Perfect. The next one is going to be going outwards with your foot, so this side. Very good. And back. And then the last one, going behind your body with your foot, reaching out. Very nice.
Okay, Dania, what's going on here?
So this is the Y balance. It's testing her ankle stability.
You're working on stability now. As I told you before, guys, the dynamic stability of hip, knee, and ankle complex is very important for you to having a good sports performance and prevent injuries. We are big on FMS in this clinic at Instep Physical Therapy. We have functional movement screen certified physical therapists on all levels to screen you and devise exercises for you, corrective exercises, strength and conditioning exercises, and mobility stability drills exclusively for your goals. So reach out to us, Giri Srinivasan, physical therapist, Instep Physical Therapy, and my team, Dania, kinesiologist, and Rube, our physical therapy assistant.
Exercise number 2 is called a floating heel hip hinge. So this one is really good on working your ankle stability as well as working your hamstrings and your glutes. Through the exercise, you want to start by lifting your heels slightly off the ground, bending your knees a little bit, and then pushing your hips backwards as you hinge forward. Try and tilt your body forward as you go down. Much better. So straight back, and then hinge forward. And now back up. And then you can lower your heels. And that's 1 rep. And you want to do 8 to 10 of them before any exercise. Through this exercise, you want to be maintaining your heel off the ground about 1 inch. It doesn't have to be very high. As Rue is showing, just enough so that your heel is off the ground. So the third exercise is a single leg RDL or a T-pose. So with this exercise, it's working on your ankle stability as well as your unilateral work on one leg, which is really important in soccer. So with this exercise, you can hold a weight or body weight if you're a beginner. So you're going to start on one leg as balance as you kick the other leg backwards, making sure you keep a flat body as you go down. So let's have your head down, keep your hips even with the ground, and try and kick the leg up a little bit more. Perfect. And then you can bring it back down. Very nice. So the 4th exercise is called a half kneeling chop. With this exercise, you're working on your dynamic stability. So with it, you're going to hold a weight in your hands and you're going to kneel on the ground. Use a pad to protect your knee. A towel works as well. Starting with the weight in your hands, you're going to rotate as Repeat has shown and then explosively twist and throw your weight up. Very nice. Perfect. Making sure you breathe through this exercise. Don't hold your breath. Perfect. So with those 4 exercises, consistency is key. With them, if you're consistently doing them, you should see some injury prevention as well as improvement in your sport performance. Those 3 injuries that we talked about, ankle, knee, and quad and hamstring strains, should see a decrease as you get stronger. Are you a parent of a soccer player? Are you a professional soccer player or trying to become one? Are you looking for an improved soccer performance, strength, and stability? Come see us at Instep Physio.